Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty.
Right, Mike, tell me what's going on with your elbow.
So pain in this left elbow, down towards the back of the joint here, down my forearm and kind of up the back of my tricep. A little bit of difficulty with extension.
Okay.
Some trouble gripping.
Gripping.
So I had the shot and the symptoms have pretty much cleared up, but
Alright, we'll go back to angel.
some residual pain and some residual
Tightness.
tightness and a little bit of weakness.
Okay. So how much pain do you feel from 0 to 10 at worst?
Now down to probably a 2 or 3.
Okay.
It was as high as a 8.
Okay.
consistently.
And what's difficult for you to do because the tightness?
Mostly twisting, any kind of sports movement, golf,
Like your arms are supposed to.
Swinging, twisting, yeah.
lifting, things like that.
How long your elbow pain been going on? How long has it been going on?
Intermittently for about a year.
For about a year? Okay. All right.
This is my second shot.
Have you had any other treatment other than shot?
No.
Okay. Is there anything else about this elbow?
Nope, that's it.
And you said you had the rotator cuff tear?
Yes.
Okay, how did you do that?
Freak accident. Landed on my shoulder 5 or 6 years ago.
So,
Decided not to do the surgery just because I didn't want to be laid up for a period of time.
so do you have any issue with your shoulder? It's okay, just limited?
Yeah, I mean, it's. I feel a little bit of little weakness once in a while, but it's fine generally.
Yeah, but your elbow is worse.
Yes.
Okay, so we're gonna work on your elbow and make sure it's not painful, okay? We're gonna do some motion and see how you're doing with this motion.
Thank you.
Okay.
We'll do the squats again. Lovely. Good day today.
Okay, so this is painful here.
I can feel it.
You feel it?
Tight.
Yeah, the painful. When I do that,
That would have really bothered me
0
before.
to 10, how much?
2 maybe now.
Okay. What's that?
Probably a 1 right along here.
1 on here. Okay. You don't let me move here. What about now?
Okay.
Turn around. Up.
And
Painful?
then either
A little.
lunges or monster work.
2 or 3
Longer
in here.
steps next.
Was that painful? Yes.
No.
Okay. Alright. So, let me know if you feel pain with what I'm doing, okay? You feel this bump here?
Mm-mm.
This one?
I think I've gotten used to it, though.
That's a scar tissue, actually. That bumpy area. It should feel.
I thought this, kind of looked, even though it was better, it still seemed to me like it was inflamed or a little bit swollen or something. So it must be what I was saying.
Feel that bump here?
Yeah.
It's a scar tissue.
You better not feel the rest of my body, Doc. It's gonna,
Yeah,
you're
well,
gonna tell me I'm one job.
if you did not have ASTR treatment, I'm sure you will have a scar tissue everywhere. You know,
That before you
because
like do monster walks out.
it's easy with ASTR to actually
Back up and then
assess the scar tissue and treat it. And you feel that here?
Yeah.
That's bump.
Nice and slow.
Scar
Scar tissue
tissue.
too? Wow.
Yeah, and you can see the redness. You see the
Yeah.
redness where the
Nice
bone.
stretch.
Yeah.
Yeah, you see that redness? That's where the scar tissue. And you see everything is like normal skin color, except just those spots.
Gray spots, yeah.
And we feel it. I feel it with the instrument. I'm sure you feel it with the. And compared to this, nice and smooth.
Nice and smooth, yeah.
Yeah. So, and that will actually cause restriction in range of motion. If it's too big of scar tissue, could compress on nerve and artery and cause nerve pain symptoms. Is it too much here?
No, it's okay.
So it seemed to be more here. That's probably you had that from your accident.
From the shoulder.
Yeah, when you landed on it. Okay. Relax. Just a little bit here for that. Is that painful?
Nah, I mean, like a tissue massage, you know.
No, this is nice.
You can always grab the count.
Make sure it's not painful, okay?
Alright.
And you can see another scar tissue.
Yeah, thanks. Doc.
Whatever you want to
Okay.
do.
I think if you grab the other arm, we could be here all night, you know what I mean?
Yeah, I'm not gonna do that.
My back too, I don't know.
No, we'll,
I didn't even tell you about my back.
well, I'll pass.
Alright, good.
So what's going on with the back?
I got a bulging disc.
So you have issue with walking or standing?
Sitting mostly. But it's, I
I
mean,
mean,
I've had,
maybe with the knees
it's-
it's a little bit easier.
I don't know if the
It'll
disc has
just go
been
up.
out of place for that long, but I've had back trouble since I was
Mm.
a young kid.
You can do that next
Oh my
time.
God, good help me.
You know,
If you
just
just try to spread
you
it
can
out,
start-
Caroline, make it wide. It's
when this
do that,
calms
it's-
down, we'll just work on it.
Then keep the tension in the band. Don't go
And then go
This
a
will
little
help
bit
dissolve the
down,
scar-
like
the scar
kind of like
tissue.
We
that
Once,
actually
a little bit
break
more.
it
Yeah,
down
kind of
with
like a
the
squat.
instrument.
Like a side lunge.
As long as you avoid any
There you
repetitive
go.
strain, because that's how we did it, you know, with the lifting weights
Yeah.
and stuff like that.
Yeah, and then you'll be done with that
So
one.
should I be just resting this still for a while?
Yeah, we'll go over what we do after this. Yeah, but yeah, we'll go over the list of do's and don'ts and the exercises I want you to do after this.
You have to slow down. It's not
But as long as you don't re-injure it
Go to the
again, there's no
Nice
reason to
big white
cause more scar tissue.
Okay.
And then we'll go over what
Like
could cause injury.
out to
So
the side
Yeah.
because
you
she
will know
wants you
what
to
to
engage
avoid.
these muscles.
Feel that here?
Yes.
It's okay, it's okay.
Is it too much or is it
No, it's okay.
Side step.
Well, the good news is actually your scar is breaking
Get it
down
high.
very quickly.
Fix it.
Some patients take them a little bit longer time to break it down.
One reason I learned this from having to do it for life.
All right. So let's move
And then
your
stay
elbow
kind of
and
like
tell
in
me
a
how
squat
it feels.
position too.
It's
There you go.
Feels better.
Any pain or it's gone?
No, it's all wrong.
And range of motion because
Yeah,
that's
it
what
feels,
you
range of motion feels much better.
Yeah.
keep some of the like
And straight. Any discomfort?
Mhm.
you stay
All
wide.
right. So what do you think about the ASTR treatment?
Wonderful. Everybody come.
All right. Awesome. Thank you so much.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.